It's me. And
have let me just introduce you quick. We have Kent Kamenicki, who is a recent graduate of TWU in exercise science, and he has some research to present on COVID-19 historical public health comparisons with the Spanish flu. If each of our participants today will take 10 minutes, I'll let you know when you approach the end of that time, and then that should give us plenty of time at the end for some questions. So with that, go ahead and take it away.
Alrighty. Okay, so like he was saying, I'm doing COVID-19 historical public health comparisons with the Spanish flu. And one thing I wanted to highlight is there's striking similarities between the response between COVID and the 1918 Spanish flu. COVID-19 has been a central issue in world news and remains relevant, especially because of the recent advancements in epidemic research and public health knowledge. And having the proper response with pandemics saves lives and it helps reduce the spread of the disease. So for my poster, I wanted a holistic view, and it specifically is broken down between the background of pandemics and specifically the 1918 Spanish flu, social distancing and general protocol, mask wearing, and future implications. So like I said before, studying the background of pandemics reveals the protocol surrounding COVID-19 is not unique. The Spanish flu had very similar protocols, including mask wearing in certain areas, closings, hand washing recommendations, and gathering restrictions. The Spanish flu closings had a similar aim as the COVID-19 lockdowns to limit the spread of the disease, because stopping the virus completely you were unable to do that, similar with COVID-19. A key misstat is that the government downplayed the virus in the same way with the Spanish flu as they did with COVID-19. Closure of businesses and limited hours were also seen during the Spanish flu. One key difference is that COVID-19 has a longer incubation period than the Spanish flu, therefore making it harder to track and spread and quarantine ill individuals. There were no widespread lockdowns seen with the Spanish flu, however. The Spanish flu in 1918 through 1920 would burn through a community in 6 to 10 weeks, and then it would be over. But this is not seen during COVID-19 because of the lengthy incubation period. The full economic impact of COVID-19 is not yet known because of the ongoing nature of pandemics. But during the Spanish flu, there's a disastrous decline of GDP by more than 10% for the typical country. Stocks were impacted on average by 26 points, and many people in the general population have tried to equate COVID-19 to the 2019 and 2020 flu strain. But that is simply a comparison we cannot make, because we had a vaccine for the 2019 and 2020 flu strain. The defense mechanisms before the vaccine were limited to mask wearing, social distancing, and standardized protocols. The CDC states that the virus is mainly spread from person to person through respiratory droplets, and these droplets infect someone when they land in the mouths or noses of individuals. The CDC recommends that individuals should stay 6 feet apart and that individuals should cover their mouth and nose with a mask, even if they do not feel sick. They also recommend individuals take their temperature if they show signs or symptoms. Contact tracing is difficult, though, with the lack of testing infrastructure, availability, and compliance. And there has been dramatic reduction in the number of COVID-19 cases seen during national social distancing protocols. Globally, there was a reduction in the number of COVID-19 cases in the June of 2020 by 65% over a 2-week period. Social distancing policies proven to be the most effective defense against COVID-19. And like I was saying before, we actually repeated history. We had a bunch of uncertainties, and then we had early loosening of protocols and hasty reversal of rules. But during the Spanish flu, but in the same way, we had like a downplay of the virus by conservatives because they wanted to keep the economy going. But actually, it's seen that with the stimulus checks, there's no widespread inflation. So if they keep sending stimulus checks, it hasn't affected the economy too badly. But the lack of widespread protocol compliance during the COVID-19 pandemic is particularly interested when considering that all the same protocols were utilized, proven effective during the 1918 Spanish flu. The main difference is that today we have technology to relay information, which helps us relay protocol to the general public. So let's talk about mask wearing. Mask wearing is one of the most effective ways that individuals can prevent the spread of COVID-19 and protect others around them. COVID-19 is spread through respiratory droplets in the air, thus wearing a mask may help contain larger droplet particles. On June 5th, 2020, the World Health Organization recommended that the general population wear face masks, specifically cloth face masks, to prevent the spread of COVID-19. TAO 2020 found that the most common reason for not wearing a face mask were claims they were uncomfortable, differing opinions on how safe mask wearing is or is not, embarrassment to wear a mask in public, or that individuals simply do not think about wearing a mask. Mask wearing is extremely important, and people may be more motivated to wear them if they find masks that are decorated in ways that they can show individuality. Mask wearing protocols are not unique to COVID-19, but the Spanish flu pandemic had similar protocols. But it only had it in certain areas of the US, such as San Francisco. And actually, they had anti-maskers back then as well. They actually formed groups. But for the Spanish flu, they used them in hospitals, and they are recommended if they are made with a half yard of gauze folded like a triangular bandage covering the nose, mouth, and chin and tied at the back of the head. They did not have N95 masks during the Spanish flu. Some research studies at the time did report declines in case numbers of influenza among people who wore masks. I'm going to touch on mental health. COVID-19 has had profound mental health impacts. Many of the public health guidelines that are in place to help control the spread of COVID-19, such as quarantines, social distancing, and stay-at-home orders, seems to have huge mental health impacts on individuals. Research has found that quarantine has substantial effects on emotional distress and mental health, which includes depression, generalized anxiety, insomnia, and post-traumatic stress. Stay-at-home orders in the United States are associated with anxiety, financial stress, and loneliness. Social distancing is associated with higher depression, generalized anxiety disorder symptoms, intrusive thoughts, and acute stress, but not with insomnia. Young adults and students in particular have worsening health since the start of COVID-19. And Grubik et al. Found that 83% of student respondents in their study on student mental health had pre-existing mental health conditions worsened due to the impacts of COVID-19. These impacts on students include school closure, loss of routine, and restricted social connections. Unlike COVID-19, there was very little research done on the mental health impacts of the Spanish flu. One of the few mental health researchers of the day found that the number of first-time hospitalized patients with mental health disorders attributed to influenza increased by an average annual factor of 7.2 in the 6 years following the pandemic. In addition, he pointed out that the Spanish flu survivors reported sleep disturbances, depression, mental distraction, dizziness, and difficulties coping at work, and that the influenza death rates in the United States during the years 1918 through 1920 significantly and positively related to suicide. And we have seen the same with COVID-19. Many researchers of the time found a connection between the Spanish flu and neurological diseases. By 1919 and 1920, physicians and researchers in Great Britain were already reporting a marked rise in nervous symptoms and illnesses among some patients recovering from the influenza infection. Among other symptoms, depression, neuropathy, meningitis, and degenerative changes were seen in nerve cells. And I want to touch on future implications and what we can learn from these historical health comparisons. The future for COVID-19 and the possibility of returning to normal life depends on preventative mechanisms in place and vaccine adherence. Vaccine hesitancy could be a barrier to addressing COVID-19, and the United States in particular has a bigger issue with vaccine hesitancy compared to other countries. And I kind of attribute this to the United States being more individualistic than other societies. In Australia, 84% of Australians support getting vaccinated and support their government's decision regarding the vaccine, compared to only 54% of Americans who have stated their intention to get the vaccine. The herd immunity threshold has been projected to be around 70 to 85%. So only 54% of Americans receiving the vaccine is not enough to return to normal life. Vaccine adherence is crucial for containing COVID-19 and reaching herd immunity. COVID-19 has increased awareness for the need for public health funding and support, and potentially, had there been a stronger public health infrastructure in place before the COVID-19 pandemic started, many lives could have been saved. The most important aspect of living through a pandemic is that the society learns from their mistakes and understands public health history, such as the Spanish flu. The Spanish flu led to many important developments for public health. Hopefully, COVID-19 likewise helps to highlight an increased funding and support for public health. And I've also read that there's already starting to be a mass exodus to public health majors in colleges and universities. And, with the US government, we're already seeing an increase in funding for public health research. And that is all I have to say.
Wonderful. Thank you so much for that. If you can make me the host again.
What do I click to do that? I'm sorry. I've never used them actually.
No, there should be, beside my name, there should be 3 little dots, and you should be able to click on it. So you might need to go to participants to do that, or you can do it based on the picture. You can see it.
I'm looking at participants, but it's not giving me 3 dots.
Decided, do you see a thing that says more? Like if you scroll over my name, Jack Seitz, do you see a thing that says more? Like a blue box.
Trying to scroll down. It won't let me scroll down for the participants. Oh, there we go. There we go. More. Make host.
Yes, wonderful. Thank you. Appreciate you. And that really interesting talk. I'm excited to get some questions from the audience. Just since we had a little bit of an awkward start, I didn't get a chance to share that you can, when it comes time, you can do it now, but also when it comes time for questions, you can simply, audience members can type them in the chat function, and I will distribute those questions by reading from them there. So, Yep, we just let 2 more people in. So for our next speaker, we're going to shift gears a little bit now and hear from a few history majors. The first of these will be Sydney Main. She's a history education major, and she's going to be giving a talk entitled "A Series of Unintended Environmental Consequences in Borneo: Mosquitoes, Cats, Rats, and Colonialism." And let me know if you need power to show any pictures. If not, you can just turn your camera on so that we can see you, or if you want, we can just there you are. Do you need any pictures?
I have a little PowerPoint.
Okay.
It's not long.
So I'm going to make you the host, but you have to make me the host back when you're done. Okay.
I promise.
Okay. So you should be able to share your screen now.
Okay. Okay, so on this first slide, there's this little map. The area in blue is the area that I'm going to be talking about. The area in green is where the cats eventually come from. So basically, in the 1950s, there was a malaria outbreak in Borneo. And in order to combat the malaria outbreak, the host sprays DDT to kill the mosquitoes. Well, when the mosquitoes die, the DDT also kills a parasitic wasp that injects its larvae into these caterpillars. These caterpillars eat the thatch, and the thatch is what the roofs were made out of. Oh, stop. Okay. That was one issue. Another issue was that the DDT also was affecting the flies. The flies were being consumed by the geckos, and they did not metabolize the DDT out. But the cats were eating the geckos, and they were dying from the infected geckos. But another possible explanation they had at the time was that the cats were licking their paws, licking their furs, and getting infected that way and dying. Well, when the cats got off, there's an overpopulation of rats, which ended up causing another disease outbreak of plague and also typhus. So, what was the cause of this? So in Borneo, before World War II, they were already a colony, but after World War II, their power shifted to the British, and they were already an area that craft crops were being cultivated, like tobacco, rubber, and there's also mining for diamonds, coal, and gold. So the new Department of Agriculture by the British was interested in improving the welfare and living conditions and the rehabilitation of cash crops. On the left, you see this. Just I know the pictures are grainy because they're old and had to be digitized, but this is of rice paddies. Prior to the British rule, they were practicing slash and burn agriculture, and their rice fields were actually in higher ground. I'm sorry about the noise. The rice paddies were actually in higher ground, and whenever they were on the right here, you see this is a rubber tree plantation, which is the crop that they were trying to produce more of. The people of Borneo had to move because they were mostly subsistence farmers, and more, they weren't necessarily nomadic, but more like they moved around, they switched their fields. Well, when they had to move, they made these permanent rice paddies, which was where the stagnant water was coming from that caused the mosquitoes to get the malaria, which was causing them to get infected with malaria. So they also increased their rice production because the British were importing labor because there is a labor shortage, but it was mostly because they weren't allowing the indigenous peoples to work on the rubber plantations. And along with this, there was like the tropical forests were being logged, and there's a lot of different things they're doing to harm the environment. So that is the cause for the initial outbreak, which would not have happened had they not been under the colonial rule, because they were already having they already had their defined forms of cultivating. So why does this matter today? In Borneo, still there is an issue with deforestation, and their crop has changed to oil palm, which is what they're getting now. And then, sorry, I have notes so I can keep on track, but my notes don't make any sense. They're all over the place. So this matters today because everything that they did to fix a problem caused another problem. And today there's still issues of effects of the food chain between other environmental aspects of logging, harvesting for the oil palm, and there's still timber plantations. And that's about all I have.
Great, thank you. So go ahead and make me the host again. Wonderful. Thank you, Sydney, for that really interesting presentation. As you know, that's several topics that are right up my alley with environment and colonialism and disease. So I think we'll have lots of great questions, and appreciate that story that you had for us. So our next speaker will.
I forgot one thing.
Okay, go ahead.
The solution to the plague outbreak from that was the British Royal Air Force. They got together in Singapore and they gathered cats. And there's reported numbers of either 23 cats to 14,000 cats that were taken from Singapore and airdropped into Borneo to kill the rats, to stabilize the plague outbreak.
Wow. Okay, yeah, that's definitely a surprise ending. So I'm sure there will be lots of questions, such as did the cats have parachutes? As we move on, though, to our next speaker is Logan Hatley. He's also a history education major. He's going to be talking to us today about a talk entitled "Foretelling Ailment: A Look at SARS and the World Health Organization's Response and Global Interaction." Logan, if you need to share anything with the screen, let me know, and I can make you the host.
No, I'm just going to talk.
Wonderful.
Okay, so SARS, or severe acute respiratory syndrome, by definition, is a viral respiratory illness caused by a coronavirus, and is typically referenced as SARS-CoV. And that should seem relatively familiar, since the pandemic that we are still in, COVID-19, is also labeled as SARS-CoV-2. SARS was the first severe and easily transmittable strand of coronavirus in the 21st century. In fact, who will say that SARS was the first severe infectious disease to emerge in the 21st century and pose a serious threat to global health security, the livelihood of populations, the functioning of health systems, and the stability and growth of economies. Furthermore, an argument that can be made towards SARS is that it is the first massive threat to the post-Westphalian public health. While many would argue that HIV or AIDS or a host of other diseases such as the Spanish flu or cholera or the list goes, Ebola, the list could go on, poses a global threat, and they do. SARS differs in its ease to effectively transmit from human to human. In further support of this claim, SARS and its associated sickness will come to shake the foundation of many world governance and economic systems like no disease ever before. And it is in this that the claim gains more ground. A significant part of what comes from the Treaty of Westphalia in 1648 was the creation of sovereign states. It is the need to work as one international body to defeat something like SARS, or in the most recent example, COVID-19, that the diplomatic issues begin to rise that attack this ideal. To further support this claim, WHO will come out towards the end of the 1970s with a health for all strategy that aims to provide primary health care for everyone across the globe. This focus on this universal approach ignores previous attempts to just look at state-centric focuses rather than a universal public health, ignoring borders. This claim comes to be backed further as we look towards the present with the current global pandemic. The pandemic of today has proved to be shaking nations and economies to their limits and has reached a higher death toll than most any other pandemic in history. Going back to the disease itself, the symptoms are extremely familiar, as they are a dry cough as much as 7 days before the onset of aches and a high-grade fever of 100.4 and over. This disease would usually lead to the individual to develop pneumonia. And a little story behind it is in February of 2003, a Chinese physician and professor will become sick with what will become the first recorded case of SARS. He was traveling to attend a family wedding and seems to have come in contact with another individual that was afflicted, who happened to be staying in the same hotel on his way to another province in China. Coincidentally, the professor was staying in room 911. It's rather insignificant to the disease itself, but it sparked a flurry of rumors towards terrorism, considering the United States had initiated their war on terrorism just 2 years earlier in 2001. It is from here in the hotel that SARS will begin to somewhat spread around the globe and reach over 24 countries. By March of 2003, Hong Kong had experienced a significant increase in cases, and it is at this point that WHO will begin to issue global travel advisories. WHO is the World Health Organization. It was created from the United Nations in 1945, following the end of the Second World War. It is from the United Nations that WHO will be created on April of 1948, specifically on April 7th, which is why that is World Health Day. In March of 2003, China will ask for assistance from WHO, and approximately 115 national health services, academic and technical institutions, and others will step in to their aid. And in little as 4 months, SARS will effectively be controlled, and practically no new cases. So when they reached out to China, 2 days, it was within 3 days that WHO had already begun to had labs across the country, specifically 11 laboratories in 9 countries, trying to determine what it was that the lead agent to this disease was, and they would figure that out within a matter of a month. And then past that, then they would issue this around the world every single day. In total, SARS would approximately only have 8,000 cases and only have 813 attributed deaths. And of these, 92% were reported from China or the surrounding areas, such as Hong Kong. Stacy Nobler from the Institute of Medicine in the United States will ask me questions towards predicting the future. 4 of these questions regarding the return of SARS is, what is the most likely scenario? One of her questions was it going to be from a transmission cycle in an area with little or no healthcare facilities, from an animal source, or from a laboratory accident. What is most interesting towards looking to the present day is that the first two seem to be rather unlikely, and that the third one was of the greatest concern to most people. And that is that a clinical specimen held in a laboratory around the globe would somehow get out from that laboratory. In August of 2003, they created a workshop and guidelines toward laboratory preparedness and planning to ensure these labs are prepared for rapid, sensitive, and specific measures to prevent this, as WHO discovered that this was the major problem, was a lack of preparedness on laboratories and the caution of the handling of infectious diseases such as SARS. Biosafety in labs was a major concern, and WHO helped establish those effective management guidelines. Another major concern was the impact of routine medical care. A major fault that was exposed during this short period revealed a major flaw in the healthcare provider's ability to effectively comply with the proper measures and regards and guidelines sent out by WHO or any other affiliated system. One major contribution that WHO found in their workshops was the medical facilities not willing to make a change that would affect their profitability. They did not want to affect their profitability in an effort to maintain their operations for normal medical care instead of shutting down to quarantine. There are many lessons that the world learned from SARS and how to better prepare for the next global epidemic. It is through this rather brief introduction that we can see how their responses worked quite well for SARS, seeing that it only had 800 deaths compared to its counterpart, COVID-19, which has significantly outweighed any other pandemic. In many ways, they are directly linked. And the question that is now raised is, how is it that one was approximately contained within 4 months and the other is still raging quite rapidly over 1 year later? And that's all I have.
Wonderful. Thank you. That's certainly, I think, rather germane to what a lot of people are thinking. So please do remember that at the end, we will have time for questions, and you can type those in the box. You can even begin typing those in the chat now if you want. And if you want them asked of a particular person, please indicate that as well. Thank you, Logan. Our final speaker today will be Charles Kaler. He's a history education major, and he's going to be giving a talk entitled Fever and Fear, the Societal Collapse of Memphis, Tennessee in 1878. Take it away, Charles. If you need to present, just let me know.
Nope, I'm just going to be doing a quick talk, so I don't think we'll need a full presentation. So that's a pretty bold title. Societal collapse, you know, that's a little bit much, as some may say, but originally I got into this because I was interested in learning more about people who were volunteering. I read about some experiences about religious workers in camps that were set up by the city and also the Catholic Church. So I wanted to find out more about that, but the research really turned on its head and I ended up finding a lot more. So I'm just going to preface some generalities, not too much data, not too much. I just want to get people excited into what's going on. So Memphis was booming in the years following Reconstruction. And by booming, I mean a population boom. And they had very ineffective administration for the city. Lots of money they had spent expanding, and they just weren't very concerned about it. Things seemed good. But they were near bankruptcy. Some say even filing bankruptcy as early as January of 1878. So to preface, things were not good. And Memphis was not, it's not like they didn't understand yellow fever. They had instances of yellow fever before, but this time it just ended up being much worse. It originated that yellow fever rumors were coming from nearby Mississippi. Rumors were spreading about victims. There was starting to be talks in the city. The city in particular they were worried about was named Grenada. Grenada promised to tell Memphis if they had any people who tested positive so that they could take appropriate methods. Many people already began to leave, though. They were like, we're just going to leave. We're not going to stand around. The people who were wealthy enough and had the connections to leave already did so. So Memphis sends out 2 people to Grenada to assist them. And before the people were even able to return, they were finding out through the Grenada newspapers that there were already yellow fever victims. So people panic and they begin to flee the city. Many went through train. They added extra train cars. They made extra train runs, but it was not enough to hold people. People were being trampled to death in the train stations. People were jumping through the windows to kind of add to a chaotic scene of what to understand. Some thought they could avoid the trains by leaving on steamboat, and they were not lucky either. Many times they got passed from town to town, could not stop, and there were even reports of boats floating by themselves with nothing but sick passengers on board due to the mosquito vector, which was then unknown to the people of Memphis. Even city legislators began to leaving the city in a complete virtual deadlock, and they could not pass through legislation to deal with the epidemic. So they had to employ emergency measures, and they had to hastily form these coalitions that would manage the city, mostly done by volunteer basis. In one quote I found, it said the established civic institutions collapsed almost immediately under the onslaught of the epidemic, many times before the virus had actually fully entered the city. Quarantine measures failed to contain everyone in one ward, which was the previous outbreaks of yellow fever's method of containment, but there were too many victims coming up, they could not keep them contained. And the object of victimhood is really something that came up over and over. There's a lot of victims in this, and not in ways of just like, oh, you got the virus, you have the fever. Those who left were met with quarantine in surrounding areas. Something that was very popular in the South was the shotgun quarantine, where they would actually hold people in buildings or in plazas by armed men with shotguns who were ready to kill on sight if anyone attempted to leave. There were only 20K people left in the city. Half had fled. 14K of these people were Black, and the other 6,000 were mostly composed of poor Irish immigrants, mainly Catholic. And so these camps were established outside of the town for some that could not leave. One was established by these hastily formed committees. The other was by the local Catholic Church. One thing I did find is that many Protestant leaders abandoned their flock, which they were met with international and national almost ridicule for leaving everyone there. The same can go for families. I read many accounts of individuals leaving children, wives, or husbands behind to die and to never return to the city. Because of this, Black people became the majority of the population. And since some of the police, of course, died, some had fled, some were moved to those camps outside of the cities. So they instituted a Black police force called the Yellow Jack. And it was run by the Black janitor and the Black cook from the police station. So those were the 2 leaders that were going around and helping out with this. And the racial tensions from the antebellum South were raging and still much in play. Black people suffered accusations of handouts from relief efforts, and fear spread about them being involved on the police force. Old school rhetoric such as sexual violence and things of that nature, but to also taking food and appropriated goods. There was actually a moment where I read a newspaper article where the Irish and the Black community worked together to publish a newspaper article about the way that they were being treated in the city, to which a few days afterward, the Catholic Church actually said that there's no way that Irish people would criticize white authority like that, and blamed it entirely on the Black people. And these Black people were also understood that once the city went back into regular dynamics, that they would have to give up their position. Looting was a rarity, except for food, clothing, and bedding, mostly because if you had contact with any yellow fever victims, typically clothing and bedding were burned immediately. In fact, you could mark how many people had typically died in one household by small piles of burnt possessions outside, including smaller piles, which were typically known to have teddy bears and things that belonged to the children of the city. This grew huge national attention and international attention. All eyes were on Memphis. The nation and the world looked on with interest and compassion. The New York Times reported that no one felt safe, and it created a sense of national trauma. And donations from around the United States came pouring in. I found countless newspaper articles about compassion for Southerners who were affected by the pandemic. In fact, one that I read in just a year previously where they were talking about Southern women, the same newspaper, the same writer wrote that women were vulgar and they were uneducated and they were not as good as Northern women. But then in the next year following the epidemic, they said, oh, they are so compassionate. This is the Southern woman. So a dynamic was changing even the way that the nation viewed the South. And that was really, really relevant. Some were going as far to say that it bridged communications and allowed a reconnection between the South and the North, especially mostly in white America. I don't know if I fully agree with that, but I'm sure that there were several instances, and at least from the letters, the prayers, all the things that I read, we saw a real turnaround in the events that the North felt towards the South after this, and that is probably through that national trauma. And the funds came in from all over. I read accounts from tons of people donating money. My favorite one was that a school for the blind in Illinois raised $21 for the effort. So it was really went to show that everybody was pitching in, and many nurses and doctors came in from other cities. Dr. Keating is one particularly that I read about in New York. And the horrible thing is that people that were writing about these, typically they died. And that is the kind of overarching sadness of reading all about this, is because the people who were staying, the people who were helping, whether it was in the camps, whether it was in the city, physicians, neighbors, whoever they were doing so knowing fully that they were probably going to die. Mortality rates among whites who caught yellow fever was up to 70%. So many people in this community, it was a very dire time. And there's a lot of conclusions that can be drawn from this. But the main one I would just mention is that if things do truly get bad enough, that the normal instance of societal flow can be interrupted, and a sense of community is the only way that we can overcome those challenges if we do not have the societal foundation that has been built for us. And that's really all I had to talk about. If you need to know any more, you'll have to ask me questions or read my paper, either one.
Wonderful. Thank you, Charles, for that really fascinating talk and look through a different pandemic that's very close to home, but also in a very different time, and sort of all the interesting things that reveals. I mean, I just want to say a few words generally about these panels, maybe a brief comment, discussion to kind of kick things off. And just want to, point out how we have a really fascinating array of ways of studying the intersection of the past and, disease and medicine and public health. And I think this is obviously a really fruitful area of study, but it also reveals, how crucial events like this symposium that we're putting on are, of getting people to understand, and talk across disciplines, because while disciplines are a really crucial part of understanding this, certainly public health people have a lot to offer, and their expertise is really important. We've also seen some really interesting insights from our students who are trained in history, and I think that those conversations really are the root of trying to address this pandemic, and maybe maybe there's a lesson there for society solving other problems that are not just health related. But I do want to just make a few comments on each. Kent showed us a really interesting story here of kind of classic framing of lessons to be learned from history, and the similarities between the 1918 and the current COVID pandemic are sometimes obvious, and also sometimes a little bit more subtle. And I was appreciating that he brought out some of those subtleties. I think the idea that this was a missed opportunity on the one hand, but I thought his final point about how there might be some hope in this, right? That perhaps the pandemic has kind of spurred a greater interest in public health among students, at least, and attraction to that major. It might be a good counteract to the question of individualism that he raised in his paper, the problem of individualism. Certainly, public health is not where you go if you are an individualist to make your money, and so maybe this is perhaps a renewed interest among future younger generations in kind of saving society before it's too late, and that might really be an interesting. I'm interested in that tension that was revealed in his talk there. I do have a question for Kent. I was curious if he found anything or had any thoughts about what he thinks the impact of the age differences might be. That the fact that the COVID, in terms of deaths, certainly seems to affect the elderly. And my understanding of the 1918 pandemic is that it overwhelmingly affected young people in the prime of their life, and what he thinks that might have to do with these questions of mask wearing and individualism. So if you can, maybe when we come back, you can start off answering that question. I'll have a question for everyone. Sydney, a wonderful story here of interconnection, and just the graphic showed just how complicated this history was. Just trying to trace something as simple as the causality of how we reached this final point. I really appreciated all the roads that she had to go down, and how it split in a way too, right? That there was this issue of thatch, and there was the issue of mosquitoes as well, and really sort of showing the strength of an ecological understanding of the world. For historians, for public health, and for us all, I think was really, really powerful and well done. But I think also at the heart of Sydney's presentation is this question of power, right? This is driven by colonial authorities who wanted to change the agriculture of the region, to develop it as they saw. And so I'm curious if Sydney could offer us some thoughts on what she thinks perhaps if there were more local voices in this conversation rather than the top-down British colonizing authorities. What role might that play? And if she thinks there's any role potentially in the COVID story for that question of local versus maybe national or international power. And connected with that, of course, is Logan's very interesting paper, also quite germane, this story of borders and sovereignty, certainly Westphalian sovereignty, taking us all the way back to 1648 to really understand what's at stake here. I think that maybe this is a bit of a meta story of the individualism that we saw raised by Kent, right? We have the nation state is kind of the individual, and Logan showed us how important it was for nation states to kind of forego that and embrace the fact that they're all in this together. And so in this modern era of global connectivity, that certainly is an important part of dealing with pandemics. And I was curious if Logan had any thoughts on what he thinks about the startling information that we find that, certain poor countries probably won't be getting the vaccine until 2023. And if he has any thoughts about how to address that and what the implications might be for those places that get the vaccine earlier. Finally, Charles has this wonderful story, or really tragic story, quite honestly, of how disease really reveals certain things about society. It tears away the mask, if you will, and reveals, how fragile this society of Memphis actually was, and at the same time tells this really surprising and fascinating story of the powerful and the powerless and the marginalized becoming powerful, right? As the white population, overwhelmingly upper middle class and upper classes leave, that sort of who's left there, and it's this very large African-American population. And so I think that was a really interesting story, kind of correcting a narrative that we can fall into as a truism, that disease only reinforces sort of the powerful, and maybe there's actually some opportunities here. And I was particularly interested when you talked about these local networks, right, and the reliance on each other, pitching in, gathering together. And I was curious if you had any thoughts about what the implications might be here for the real costs that we've seen with COVID, and sort of who bears the brunt, and if he sees any analogies or any connections there. So if we could just go through, Kent, and then in the same order that you went to answer my question, and meanwhile people can type other questions they have in the chat, and we'll get to those in turn. So Kent, if you wouldn't mind.
Alrighty. So, Jack, I understand you were posing a question about mask wearing and individualism and kind of the impact on that.
And also, I'm curious about my understanding that in 1918, there was the ages most typically that died from this were people in their 20s and 30s, and what you think that might have to do with resistance to mask wearing, and how that's different than now, where the overwhelming number of deaths are the elderly.
Well, I think as far as compliance, 20 to 30-year-olds back then may have been more apt to wear masks. I think, I have seen some, just anecdotally from what I've seen that like younger adults still want to take precautions as far as wearing masks. But a lot of times when they get around their friends or they get around people they know, they get less collectivist. And one thing that's puzzled me about younger adults as far as mask wearing is that, they'll wear it around strangers, but when you get in front of your friends and people in general, when they get around their friends, they take the mask off. And, for me personally, I think mask wearing, you want to protect your family most of all, it's even though you want to protect others. And I think the difference with age groups as far as, I feel like compliance would be much better, as like I said, as far as mask wearing with the Spanish flu, just because, that impact of people your age dying increases that anxiety level. And, with an increased anxiety level, you have better mask compliance. Like I was reading that, people who follow social distancing guidelines were more, compliant when wearing masks. And that there was a significant correlation between the two. So I think there's probably more compliance back then than there is now as far as younger adults. I've been around a lot of younger adults, around the golf course, and they're like, well, it doesn't affect me and stuff like that. And over the summer, they were like, well, I'm going to keep living my life because I'm young and it doesn't affect me. But, they need to have a more collectivist mentality. As far as, a young person spreads it to the younger young person, then they spread it to an older adult, or even the young person with a variety of risk factors. They can, potentially kill those people. And, as far as flattening the curve goes, you got to think about the whole impact of you as an individual has on the rest of society. If I spread it to somebody, it's just like it's a spider web going out. So, I think that poses really good questions. And I've seen a shift to more a collectivist mentality, especially down in the rural South. Mask compliance has gotten better as it has impacted people personally. I've met folks that, they wouldn't wear a mask over the summer, but once the holidays hit and they know somebody that passed away for it, it really hit home, and they got more collectivist, and they were less, they were less apt to focus on conspiracy theories or numbers being inflated. Instead, they were focused on, protecting their fellow man, and they finally got it. And it's sad that people have to be personally impacted. And that's why I believe that, compliance would have been better during the 1918 flu. As far as if they know the precautions, it's much easier to communicate precautions and protocol nowadays, rather than back then. It was mainly spread through word of mouth or newspapers and stuff like that. And you still had conspiracy theories floating around in journalism back then. So, I think that is an interesting point is, back then, maybe you had older, I didn't find this, but maybe you had older adults that wouldn't wear a mask because they were like, well, it only affects the younger adults, and that would be really something interesting to look at to see, if there was a ability to quantify compliance back then as well, and kind of compare the two, because I do think age plays a huge role, just because I had, we still had down here, we still had fall athletics going on with younger adults and stuff like that down in Tennessee. And so I think it's a huge component, is that which age group is impacted, even though in my opinion, it shouldn't be that big a component, because we're all in this together. And
Right.
we shouldn't be just, that's still an individualist mindset. If you're like, well, if it doesn't affect my age group, then I'm going to not stay home,
Sure.
So I think there's a shift to be more collectivist, as there's an exodus to public health right now, and that they're seeing a growing number of public health majors.
Yeah, wonderful. Thanks. Appreciate that. Sydney, do you have some thoughts on the question that I pitched to you?
Can you actually repeat the last
Sure.
half of the question? My AirPods died and I missed
Sure.
that.
Yeah. So I was curious, in the in your story, you have this description of kind of colonial power, and how authorities are the ones who are in charge, and they're the ones who are deciding, how to treat this with DDT or with cats, as the case might be. And I was curious if there was a similar story that might be told here with, that could have been fixed in some ways if there was more local power, more local say in how to address the problem that the colonial authorities were trying to address. And if you thought there was, like, what role might local power or local input have in kind of the COVID pandemic in the middle that we're in the middle of now?
So they actually, and what I found was the British allowed actual, like, local residents of Borneo to have some sort of office held and some kind of minimal amount of power. But there were revolts before and after and around the same time that they were dropping cats to stabilize the rat problem. So I'm not entirely sure how to answer your question other than that.
That's fine. Just if you did have some thoughts about how, if there is a role for local voices in maybe getting mask compliance or something along those lines in the COVID pandemic. It just was sort of a question that came up in your paper.
I'm not sure how to tie mask mandate and COVID along with my paper. However, I do feel like in America, at least, it's hard because people are so stuck in their mind to comply with any kind of mask mandate because they didn't and they still don't. Don't come at me. I'm outside. There's nobody around me. But I feel like if there was more people who were prominent in the communities that were speaking out again about wearing masks, there might be more compliance. But because, especially here, people don't want to because of conspiracy theories and because they want to have their individual rights, even if it harms other people. Does that answer your question?
Yeah, thanks. Totally appreciate that. Logan?
So your question, just to make sure, was you wanted my thoughts on the fact that certain poor countries won't be getting the vaccine in the most recent reports until 2023, as opposed to like the United States, who has it now.
Right.
I think that it's interesting. There was an aspect during SARS that as they found out all of this research, while they were trying to share it globally, it was mostly only being shared across the Northern Hemisphere, not the Southern Hemisphere. And it wasn't until months later that they began to start sending this information to laboratories or even government entities in the Southern Hemisphere at all. Now that doesn't really answer your question, but it just adds to the to the question of, I guess it really plays a role into what I would call global capitalism, and it kind of ties directly as to. Oh, I've lost my train of thought. Hold on, it'll come back. Oh, the othering of people really is, I think, what that plays into. So you have nations such as the United States, which considers itself, I mean, we could use American exceptionalism. It considers itself quite prominent in the world, if not the most prominent nation in the world. And as we have seen, there are figures and other members of the American society willing to ostracize other people due to certain factors, such as the COVID-19 coming from China, being somehow significant. And some might say that this othering is really tied to why these other nations will not be receiving it until much later, as opposed to nations such as the United States or United Kingdom, or a lot of Northern Hemisphere countries.
Yeah. Thanks. Charles?
You're gonna have to run that question by me one more time. In the sauce of all that, I've forgotten what it is.
There was a lot going on. So I was curious about how you talked about, the creation of these local networks, Black police forces in Memphis, and how this is sort of a heroic story of perhaps opportunity for like the less powerful to have some power, some stature in society. And I was just curious if you saw any parallels between that and the essential worker and the healthcare worker sort of praise and signs that people were putting out, especially early in the pandemic. We're all in this together. And if you see any kind of parallels there between those two.
Certainly. I mean, the praise is there. I mean, we praise the essential worker. We say, you are essential. If we did not have you, we would be in trouble. But when it comes down to raise their wages, no, you have enough. You're essential, but we don't want you being too essential. So I think that is a very huge parallel to what we're seeing here. Even at the end of this, I'll ruin a little bit of it. At the end of all this, the Black individuals do lose their positions in the police force, but they are celebrated for helping during this time, and they have they all have this collective like Thanksgiving thing. Once the frost sets in and it's all kind of over, they get heralded there. They get newspaper. People were wrong about them, but not wrong enough to start treating them like people until if ever. That's kind of the issue. And I feel like both individuals in this case do lose a lot. They put a lot on the line, and many times they did not have a choice in the matter. It's just the way that the dice were rolled. They were continued on. They helped their communities. I am proud of them both, but I think that neither has gained the recognition that they deserve.
Yeah, it's a. I mean, I think something similar to, maybe we'll end with this, to what Kent said, how there's a lot to be learned about pandemics and public health and from the past. And that doesn't just have to do with, do we get people to wear a mask or not? Perhaps there's some broader social questions going on. Kent has a comment in here in the box. I'm just going to read it out. I think it does have an effect, however, in being highlighted in the news that certain populations will cause others to become more combative. If someone believes the media has a certain agenda or is spreading fake information, it could cause them to be, I just lost it. Less likely to wear a mask. On the other hand, if someone believes that what the news has to say and believe, right? And so there is a question here that's sort of maybe bubbling beneath the surface of trust, right? What are the institutions that are trusted? Who are the people that we can trust? Is it scientists? Is it experts? Is it the government? Is it the media? Or is it just certain parts of the government, certain parts of the media? And I think that that's a big question that came up in our discussions around cholera last night, and certainly in this COVID time is high up on people's questions around this, I think. Are there any other questions from any of the audience members? I don't want to hold you too much longer since we got a little bit of a late start due to some technical glitches, but I do want to, first of all, make a further plea, a further push for people to check out the symposium events for the rest of the week. Tomorrow evening, we'll have a wonderful panel on questions of stigma and pandemics. So we'll be talking about public health, harm reduction around the opioid epidemics and AIDS epidemics. We'll also, on Friday, we'll have a panel on family and how family responds to pandemics and sometimes new concentrations or new creations of family, which I think dovetails with some of what Charles had to describe in his in his talk today. And of course, on Thursday, we will be joined with Dr. Dale Lawrence, who was crucial in working for the Centers for Disease Control during the AIDS pandemic of the 1980s and exploring and understanding how the disease was transmitted. So I encourage you to check out the Tennessee Wesleyan Library website and the schedules of events that are posted around campus so that you can join us for more of those and continue these really important conversations. But also, I just want to heap some praise on our wonderful students here at Tennessee Wesleyan, who this to me makes me so proud. This is oozing the liberal arts, pulling on ecology and sociology to understand race and class, pulling on kind of global diplomatic history, and in addition to our public health majors who come in and ask these interesting and useful historical questions. I think it really shows how important and how useful liberal arts education really is. And so I think our students are to be commended and I appreciate their hard work personally, but also on behalf of all of your professors here at Tennessee Wesleyan. We're very, very proud of you, and thanks for contributing to this wonderful discourse. So with that, we'll see you all at future events. Thanks so much for joining today, and have a great rest of your day.
Thanks for being here, everyone.